Hello, thank you so much for having me. My name is Kimarie Knowles, and I'm a social worker who's worked with cancer patients and their caregivers for the past 15 years. Today, I'm here to talk with you about survivor guilt in cancer survivorship. I do want to make kind of a quick note on the word survivor or survivorship. I understand that that term does not feel comfortable for some to use, and that is okay. I will be using it in its broadest sense, meaning anyone who has been diagnosed with cancer from the moment of their diagnosis through the end of their life. And in this definition, I'll also include caregivers and families, as we know that they also have been impacted by the cancer experience. Oh, my friends, forgive me that I live and you are gone. There's a grief that can't be spoken. There's a pain, goes on and on. So today we're going to spend a little bit of time talking about what exactly survivor guilt is. We'll look at some of the symptoms that we see in the cancer population. We'll go over some theoretical perspectives to try to help us conceptualize and understand survivor guilt. And then we'll talk a little bit about some of the coping strategies that can be used. So I want to start with the fact that survivor guilt is not a formally diagnosed condition, but that doesn't mean it doesn't exist. It has been described as the experience of individuals who live through an event in which others have suffered or died. It's a common experience for people to feel bad or feel guilty when they survive something when another person has died. And often this response to this experience involves intense fear, helplessness, or horror. Symptoms of survivor guilt can vary, but in cancer patients and survivors, there can be a need to justify one's existence, a feeling of doing something wrong when enjoying life again, feeling depression, anxiety, hopelessness. All of these are common, often with an added sense of self-blame. Some individuals have sleep disturbances, a loss of motivation, substance abuse, and excessive vigilance. When we look at the history of survivor guilt, the idea first developed in the late 1800s with Sigmund Freud, who identified guilt as one of the feelings that he had after his father's death, noting the tendency toward self-reproach with death, which death invariably leaves among the survivors. Nederland is credited with being the first theorist to write about survivor syndrome in his work with Holocaust survivors, who were described as maintaining persistent guilt and a fear of being punished for having lived while their loved ones perished. Over the past decades, survivor guilt has been used to describe the response among Holocaust survivors, war veterans, survivors of natural and man-made disasters, HIV/AIDS survivors, survivors of terror attacks, bereft caregivers, laid-off workers, and the medically ill. Different theorists have tried to understand and conceptualize survivor guilt. One of the ways that they've done this is the social and evolutionary perspective. So basically, these theorists have looked at survivor guilt in the context of communal relatedness. They argue that guilt is an interpersonal emotion that works to enforce communal norms, which encourage pro-social behavior, like mutual concern, respect, positive treatment among group members, sharing. So basically, these theorists say that in our evolution, guilt was one way to keep the group working together, sharing resources, getting along. And within these interpersonal norms, an ingrained sense or a moral sense of fairness and equity developed. And people feel guilty if they perceive that they are getting more than their fair share, going against this moral sense. I think most people would like to believe that life is fair and equitable, and a cancer diagnosis can shift our understanding or our belief about this. It is unfair that some people die of their disease, or that some suffer more than others. For some, feeling that they had better luck for no reason can lead to feelings of survivor guilt. One theorist uses the term depletion guilt, which describes the guilt that comes when there's a belief that one's good fortune is taken at the expense of another's misfortune. Ultimately, this can create a survival death connection where it seems like one person's survival is at the expense of another's death. So another way to think about this perspective is the struggle, that is a struggle around the way that the world should operate, right? So an ethical world should operate in a way that is fair and equitable. Even if we realize that our survival is not connected to another person's death, we might still feel like there is this unfairness. And how do we grapple with that? How do we grapple with the unfairness that exists in the world if an ethical world should, and we have a kind of a moral sense that it should be fair, it should be equal? So often this can kind of create a disconnect between what we know, right? We know that life can be unfair. We might cognitively know that, and yet kind of inside our feelings, we might feel like that there's something that's still wrong with that. And sometimes that disconnect can create some survivor guilt as well. For some, it can kind of feel more comfortable to hold on to these beliefs that we have. So we often have these ingrained beliefs about who we are, about ourselves, about how the world operates, and about how we go about engaging in the world, the relationships that we have. And often we don't even question this sense that we have. So that there often is just a belief that, if we work hard and we follow the rules and we do the right thing, then usually things will work out. Well, cancer can kind of shift some of those beliefs. But sometimes rather than actually change that internal belief, we say, no, that like I still believe that things should be fair and equitable. And so this experience not fitting into it can have us kind of put us on a search for ways to control or ways to make up for this disconnect. And survivor guilt is one of those ways. So we understand that survivor guilt is an interpersonal experience. It is about identification and connection to others going through a similar situation. One study looked at survivor guilt in patients with renal disease who were treated at a dialysis center. And they found that those individuals who had a strong sense of camaraderie, which was identified as facing a shared threat or danger with a sense of who lives and who dies being outside of any one person's control, that was associated with higher levels of survivor guilt. Now, it's really important to recognize that this identification and connection overall does have very, very, very strong benefits for most patients. We know that there can be this shared sense of connection and intimacy in treatment rooms and chemotherapy suites and hospital floors and support groups. And most of the research says that actually that is helpful. It can decrease feelings of isolation. It can decrease feelings of anxiety and depression. It can improve quality of life. However, in knowing that when you're connecting with other people who are going through a similar thing, it is important to recognize that if someone shares a story where they've suffered more or they die from their disease, that these feelings of survivor guilt can come up. So if you're experiencing survivor guilt, you may be asking yourself the meaning of your experience. So one question, right, the question of why, often at the beginning, it is why? Why did I get cancer? Why did this happen? And in survivor guilt, and towards the end of treatment, often that might change to why did I survive when others didn't? Or why have others suffered more than I have? So alongside these questions are often judgments about what you should be doing, what you should be thinking, what you should be feeling or saying. And many feel like if they've survived when others didn't, there needs to be meaning and purpose, or greater meaning and purpose in life, just to justify one's existence. Now, some people do search and find ways to create meaning and purpose from their experience and in their life. And studies have shown that actually that can be very helpful. But that doesn't mean that everyone needs to go down that path. Not everyone needs to have an epiphany. Not everyone needs to make major changes in their life. Many people simply want to return to the life they had prior to illness. And the notion that because you were diagnosed with cancer and you survived, that you have to do something better, greater, more important, that feeling that you should, or that there's this need to, is what can contribute to feelings of survivor guilt. So often individuals who are experiencing this can look for ways to try to compensate for the benefit of surviving. But those attempts often fall short, because in the end, nothing can really bring back the person who did not survive their disease. And that is a hard reality to hold, a sadness to hold. Sometimes we also can get stuck in these unanswerable questions, these existential ones, like, why did I survive? Or what if questions, like, what if he got diagnosed earlier? What if they didn't give them that last treatment? And when we can get stuck, we can get into the cycle of rumination, where the guilt itself prompts this cycle of questioning that often don't have answers, which ultimately can lead to more guilt. So the existential questions themselves are not the problem. Asking these questions, searching for understanding, trying to find meaning and purpose, these can all be very beneficial things to do when you're diagnosed with cancer and post-treatment. What gets us in trouble are the shoulds, right? When all of a sudden we're putting a judgment that we should be doing something different. Because anytime we say that we should be doing something different, what that means is that we're not doing something, we're doing something wrong, or we're not doing something right. And the rumination cycles that we can get stuck in. Survivor guilt occurs when the individual believes that the good in his life is experienced at the expense of those who did not survive. When the survivor lives on, the transgression he commits is his own existence. The individual feels guilty when good things happen in his life because at the back of his mind, the question is always present. Why am I here to experience this when so many others are not? This is one perspective of how survivor guilt is experienced. Another perspective is that survivor guilt works as protection, as a defense. So when we think about why we have the feelings that we have, one way to think about guilt is that even if we don't like the feeling, there might be a reason why we're experiencing it. There might be a reason why we're experiencing survivor guilt. So this idea is that it might be kind of a defense, a protection against other emotions that we might be holding, that might be underneath the guilt. So one reason that this perspective exists, one reason why we think this, is that we know that guilt is an emotion that gives us some illusion of control. It prompts us to do something. So when we feel guilty, often it can feel like an active emotion, right? There's ways we want to make amends or restore what was uneven or unbalanced. It can feel like, well, if I feel guilty, then there is something to do, which again can give us this idea that we're in control. And some of the feelings that may be underneath this guilt can be a feeling of powerlessness or helplessness. feelings of death anxiety, and feelings of grief. So we know that survivor guilt is connected to a sense of powerlessness and helplessness in the face of loss, trauma, and one's own mortality for many people. So the feeling that things are out of control, the feeling that one is helpless with a cancer diagnosis and through treatment, it's common, it's understandable. Cancer doesn't discriminate, and often patients report feeling that their choice really is to just follow the medical team's advice. And they just do what they're told, and they don't always feel like they have a lot of agency. So survivor guilt in the service of protection, in the service of this defense, is one way to cope with what can feel like very overwhelming feelings of powerlessness and helplessness. So guilt can help us feel in control. So if we go back a little bit to what we discussed earlier with our internal belief systems, many of us operate with kind of this idea that the world is more or less fair and equitable, that if you do the right thing, that you will be rewarded. And there's also, for many people, there's also a belief that we have some control, that we have some agency, that we can choose to work hard, and there'll be something to show for that. And I would say that the majority of the time that is true, but sometimes with the cancer experience, it doesn't quite fit. So again, these belief systems are ingrained in us. Now, not every person has a different belief system. Not everyone has these belief systems as I'm describing them because of their own personal experiences in the world. And we know that there is unfairness in the world. And if you've grown up with injustice and unfairness in your world, then that will impact your belief system and the way that you view the world and the way you view yourself in the world. And so one of the questions to look at here really is, what is that belief system? What do I believe I should be doing in terms of how much control I have or how the world operates? And if it feels really uncomfortable to feel like you don't have control, then that might be some of the places where survivor guilt can come in. So, and I want to just note that kind of feeling in control can be a really important thing, right? It can be a really important way to cope with your illness. So we know that like getting information about your disease, finding ways to finding ways to cope with the side effects, with the symptoms, with the emotions. These are all ways to feel like you have some agency, and all of these can be really, really vital. I think what I'm saying here is that for some, when you get a cancer diagnosis, the feeling of powerlessness, the feeling of helplessness can be so overwhelming that it's actually sometimes easier to feel guilty. It's easier to feel guilty about something because that can help you feel in control. For many cancer survivors, a diagnosis also forces them to look at their mortality, which includes an awareness of one's vulnerabilities and their lack of control. Recognizing who lives and who dies is outside one's control can be extremely overwhelming, can cause great anxiety, sadness, and fear. Death anxiety is the term that is used to describe the worry and the fear that comes with thinking about or acknowledging our mortality. So Yalom says, it is not easy to live every moment wholly aware of death. It's like trying to stare the sun in the face. You can stand it, so you can stand only so much of it. Prior to a cancer diagnosis, many patients may not have thought of their own vulnerabilities and lived with what we call a veil of denial. So the denial of mortality can be adaptive and very healthy. It kind of keeps this constant awareness of our vulnerabilities at bay and allows individuals to function, right? To function in the world. A cancer diagnosis can lift that veil and really necessitate the development of other alternative coping mechanisms to manage some of these overwhelming feelings. So again, that one of those ways of coping might be survivor guilt, might be to feel guilty. Finally, grief is an understandable experience and a feeling when you have cancer or when a loved one has cancer. And that also can be kind of one of these feelings that might be underneath survivor guilt. So survivor guilt, in terms of grief, survivor guilt can actually serve as a commemorative function. Holding on to feelings of grief can be a way to hold on to the connection with the person who died. This has been evident in some Holocaust survivors who voiced fears around letting go or forgetting the dead. So holding on to guilt is seen as one way to be loyal, one way to keep them close. Grief can also be connected to survivor guilt when it's about one's own cancer experience. So some individuals may feel guilty for feeling sadness, loss, anger about their own situation when they know others who suffered more or died from the disease. Others grieve for the loss of fellow cancer patients. Grief can be uncomfortable to sit with. And just like the feeling of powerlessness and death anxiety, guilt can give us this illusion of control or urge to do something. Cancer survivors often enter counseling or support group, kind of stating that they shouldn't be upset about their experience as others had it worse. Many will discredit their own physical, practical, and emotional challenges related to their cancer diagnosis because they don't feel they have the right to complain. They don't feel that they should kind of feel any of the uncomfortable feelings, because in some ways the only feeling that they're allowing themselves to feel is gratitude, or feeling blessed, or feeling appreciative that they're alive. So sometimes the guilt can serve as a way to kind of push away some of these other uncomfortable feelings. It can kind of invalidate the losses, can provide some distance. So, you know, if you're saying, well, I shouldn't feel sad because I got cancer because someone else had it worse, then you're not allowing yourself to feel sad. So the survivor guilt itself doesn't allow you to feel the grief, to feel the sadness. We also know that survivor guilt and grief can also have a lot of conflicting feelings. So many survivors do feel relieved and grateful that they're alive. And these feelings can be in conflict with sadness or grief or anger or frustration around their experience. They can also be in conflict with the sadness and grief around other people who have died of their disease. So there's important things to think about with our feelings. So especially when we're trying to untangle all of the feelings that we may have. The first thing is that might be helpful when we try to think about feelings is just because we feel it, or just because we think it, doesn't mean that it's true. So a feeling of guilt sometimes will lead to the assumption that we are guilty, right? So, but sometimes the feeling itself of guilt is just that. It's a feeling of guilt, and it does not mean that we've done anything wrong. Second, a feeling of gratitude or relief or happiness when thinking about your own survival does not have to take away from the feelings of sadness or empathy about someone else's suffering or death. We can have both feelings at the same time. And feeling gratitude, even when you hear about someone else who is suffering, doesn't mean that you feel gratitude about that. It means that you can hold a feeling of gratitude and capital A and D, and you can also feel grief and sadness, both for the experience of other people and for your own experience, right? You can feel appreciation and relief that you've survived, and you can also feel anger or sadness that the cancer experience has changed you, and that there have been losses related to what you've been through. Really, kind of the idea is that you are entitled to all of your emotions, and it is expected and normal to have a range of them, especially after a cancer experience. So from happiness to relief, to gratitude, to sadness, to anger, to frustration, grief, to feelings of helplessness, like all of these are normal and expected emotions when you've gone through this. And you don't have to choose, right? You don't have to have one or the other. You can have all of them. But we do know that having them at the same time can sometimes lead to survivor guilt. So sometimes it's easier when, for example, if you are feeling frustrated about your own cancer experience, rather than saying this is normal, this is understandable, you might think, I shouldn't feel this way because my friend who I went through treatment isn't here, and they can't even they can't feel anything. And that's not fair for me to then feel sad. And just in that, telling yourself that you shouldn't feel that way, there can be survivor guilt. There can be guilt that can come up. So one other thing about feelings, just to keep in mind, is that one thing to check in with yourself about is not just what are the feelings that you have, but what are what we call our secondary appraisals, or our metacognitions. What are our thoughts and our feelings about our feelings? So if you feel guilt, the feeling of guilt itself might be a natural feeling. Then what second level do you put on that? Do you believe that feeling that guilt is important so that you don't forget the person who died? Do you feel like feeling guilt is important so that you always remember that you should feel lucky for your survival? If you feel that it's important, then it's going to be a harder emotion to get rid of. The same thing with any emotion. Anger, what are your beliefs? What are your thoughts? What are your feelings about anger? So if you feel anger, do you tell yourself that you're not allowed to feel anger? Or that, is your anger scary? Does it frighten you? Right? So being curious about the secondary appraisals, being curious about the way that we think and we feel about our feelings can give us some insight into why we might be holding certain things. So I wanted to just give a few case examples just to highlight some of the ways that this might look in cancer survivors. So we'll first talk about one note, all of the names have been changed and the stories have been adjusted so that they don't identify any specific individual that I've worked with, but kind of these case examples have come from the work that I've done in individual therapy as well as support groups, and often just have been created by a number of different stories that I've heard. So first we'll talk about Jeff. So Jeff started seeing me about a year after his treatment, and he was diagnosed a few years earlier with leukemia. He brought up, in our first session, his friend who died 3 months prior. His friends we'll call Alan, and they met while undergoing treatment. They both were hospitalized and went through a transplant at the same time. They formed a close relationship. They connected via phone and social media and email. And the treatment was quite long. So it went on a couple of years. And about 6 months after Jeff's treatment ended, Alan's recurred and he died shortly thereafter. Jeff had gone to the funeral, kept in contact with Alan's family. And the way that he looked at this was that it was unfair. So we talked about Alan's life. Alan had a good job. He had a supportive partner. He had children. He had a mother, and Alan was the only child. And Jeff would compare all the things in his life to those that Alan had. Jeff stopped working during treatment and didn't know if he would go back. He didn't have a partner. He didn't have children. He had siblings. So he kind of believed that he should have been the one to die instead of Alan. He didn't feel like he was worthy of surviving. He didn't understand how a good person with a good life and lots of people who needed him could die while he got to live. And so this is, this kind of case example is common. This is a common thing that we see in survivor guilt. So often it'll be related to someone that they went through treatment with, or they connected with. It might be someone that they even follow on social media, but really felt a shared affinity with. Another example is a patient we'll call Liz, who is a young adult, and she struggled with some anxiety, mainly around her scans and fear of recurrence. And one of her biggest struggles really was feeling like she was able to move on with her life. She had a partner who wanted to get married and kind of move forward, but she didn't feel quite ready for these next steps. And when she told her story, what we learned was that she was diagnosed when she was in her early 20s in college, and she finished treatment and really felt that she went through it without having really any trouble. She finished college. She had a supportive family. She moved on and got her first job. And about a year after she went through treatment, another individual, another student at the college that she was attending had got the same diagnosis, and they were connected. And she spoke with the patient and this other student and this individual's mother, and at the time felt really good about kind of providing hope and feeling like kind of giving them some light as they were just diagnosed. And they kind of followed each other on social media. And a little while later, a few months to a year later, she found out via social media that this woman was on hospice. And she didn't know what to do, right? So she didn't reach out, but then she started feeling really guilty, that what if she provided false hope, feeling guilty that she didn't know what to say and she didn't know how to provide support to this individual at the end of her life, feeling worried that this other young woman's mother hated her and wished that she weren't alive because she had survived. So again, each case example, each person's experience with cancer and their connection with other cancer patients is going to look different. And so their experience with survivor guilt might look a little different as well. I want to give you one more case example before we move on, just to kind of demonstrate that there is a range that can happen. So we'll call this patient Angie. And I met through another survivorship group. And she came to the first session claiming that she did not deserve to be there, that she had a good cancer, that she was 5 years, she has not had a recurrence. She kept on asking in the first couple sessions of the group if she's taken someone else's place that might need the group more than she did. She offered to stop coming. She talked about how her cancer was caught early. She only had to have surgery. She didn't feel like she had any side effects, any negative side effects from that surgery. She didn't have radiation. She didn't have chemo. She wasn't sick. And she, as she was listening to other individuals who had some quite traumatic stories and experiences, she felt really guilty. She felt guilty and didn't even know why. She kind of didn't know why she was still thinking about her cancer. She felt like she should have just moved on. And again, so this is in some ways, with this example, we're seeing how, and what we learned in the work that we've done, what we did with her and in the group, is that she was holding feelings, other feelings, some anxiety and some grief, that were hard, were challenging, were difficult to hold, and kind of denying it, saying that she was fine, that she wasn't allowed to feel anything but a positiveness about her cancer diagnosis and experience was what caused some of the guilt. So hopefully this has helped you understand or put different perspectives on what survivor guilt is, what it might look like. There's not just one right answer to survivor guilt. This is about trying to understand and saying, well, what things did I say that might fit with what you're experiencing? And looking a little bit more deeply to see, and asking the question, being curious, why am I feeling this way? What else might be going on? So now let's just talk a little bit before we wrap up about what if anything there is to do about it. So the place that I start with pretty much all the cancer patients, survivors, caregivers that I work with is acknowledgement, normalizing, and validating, all with compassion. So I start here because what I find is that most people have a tendency to be a little bit self-critical, to have a little kind of inner dialogue in their head that is not always so nice, that offers judgments, that offers lots of shoulds, that makes us think that there might be something wrong with us. So the first thing that I think is really important to do is acknowledge what you feel without any judgment. Acknowledge whatever that feeling is, and acknowledge what some of those secondary feelings might be, or what those secondary thoughts might be. So acknowledging if you feel sadness without telling yourself that you're not allowed to feel sadness or that you don't have the right to feel sadness. Just saying this, yes, this is what I'm feeling, right? The whole range of emotions that can come from a cancer experience. And then, and in that acknowledgement, not jumping to do anything, right? A feeling is just a feeling. You don't have to fix it. You don't have to get rid of it. It just has to be felt. And most feelings, if we allow them, they pass, right? We feel something. It doesn't always feel that as intense. It will subside in time. So really the trick here is to approach your feelings, approach what you feel with some curiosity. Almost like, oh, that's interesting. I'm feeling guilty right now. I wonder why I'm feeling so guilty right now. The next step is to remind yourself that it is normal. Remind yourself that other people feel this way. So normalize and validate. Remind yourself that this is a normal experience for cancer survivors, and that many other people are going through it and experience it as well. There's nothing wrong for feeling this way, even if it is uncomfortable. The third step is to try to respond to yourself always with compassion. I know, and when I say that, I think sometimes it's easier said than done. What I mean by that is sometimes really changing that inner monologue and that inner talk to the way that you would speak to someone who you're kind of taking care of, who is hurting, who is struggling. So acknowledging, I know I don't like this feeling. It feels uncomfortable. I know it's normal. I know it'll pass. It's okay. Kind of being able to be gentle with yourself. When we think about self-care techniques, what I'm talking about really are the ways that we take care of ourselves on a daily basis, but especially when feelings and our emotions are very intense. So what we know that for some people, the intensity of their feelings can be overwhelming. And it can be so overwhelming that they just want to get out of the feeling, get rid of the feeling. And so some of these self-care techniques, if practiced, are ways to really help us moderate and help us turn down the volume of some of these overwhelming feelings. So feelings live in our bodies, right? So having some strategies to, most feelings live in our bodies. Some feelings live in our brains, like anxiety or rumination, but a lot of the feelings, even anxiety, we might feel our heartbeat. We might feel sweaty. With sadness, we might feel more lethargic. With anger, we might feel hot. So all of these feelings that live inside of us, some of the best self-care techniques really are focused on ways that we can make our body feel calmer. So this is going to look different for each person, but some of the strategies that may be used include listening to music, exercising, deep breathing, meditation, mindfulness, writing, journaling, yoga, qigong, or other movement-based techniques, a bath or a shower, talking to a non-judgmental supportive friend or caregiver or professional, resting, sleeping, and some grounding techniques. Now, I think the key here is to practice these. So in the practice, even when we're not feeling emotionally triggered, practicing these ways of calming our body down ultimately helps us when we are triggered, when something does happen and we have an overwhelming emotion, to utilize some of these strategies to help regulate them. So another important aspect to remind yourself when survivor guilt comes up is that your experience is separate from others. So you can take a moment to acknowledge the feelings of both. You can acknowledge that you feel survivor guilt, right? You feel survivor guilt. It might be triggered by a media image, a commercial. It might be triggered by the anniversary of another patient's that you knew, their death, or their birthday. You can acknowledge that feeling of guilt. You can acknowledge your feelings of sadness and grief and struggle. And you can also acknowledge the feelings of relief and sadness. So recognizing that there can be all of these different feelings, and that what you are feeling can be different from what another person experienced. Kind of a note on grief and grieving. We live in a culture that often does not give enough space or time for grief. We move on. We encourage you to only look at the positive side of things. But the reality is that a cancer experience does bring grief to many people. Grief about other patients' deaths, grief around the losses experienced by cancer, physical losses like scarring, practical changes like financial and insurance, job changes or adjustments, and the whole host of emotional changes and loss. Right, the loss of yourself as healthy and invincible, even the loss of innocence. I've worked with some patients who have talked about this loss of innocence, where the rest of their life they have to hold a little bit of that fear of recurrence or anxiety or acknowledgement of their own mortality. And how do you hold that? How do you hold that and still find room for joy? It can be done, but often there needs to be some space for the loss of what was before the diagnosis and treatment. In connection to grief, it can be really important to honor your experience and honor the experience of others. So for some people, experiencing survivor guilt, honoring what you went through, honoring what you learned from this, or honoring how you grew, honoring your own story, being able to tell your own story, can be very beneficial, because the reality is that for many people, a cancer diagnosis and treatment can feel traumatizing, and having some space to tell that story, to acknowledge it, to hopefully get some non-judgmental support can be very beneficial. And likewise, if you do have someone that you connected with in the cancer population that has died, finding ways to honor their experience and their life in a way that feels authentic to you can also be helpful. The next three kind of blocks really have to do with this exploration of your own thoughts and your own beliefs. And sometimes that can be done best in a supportive counseling environment. So when I talk about addressing rumination, what I mean really is kind of assessing when rumination gets into the spiral, and what are the strategies that you use to help yourself get out. They're not going to be that different from some of the ones that we just talked about in terms of self-care and compassion, and normalizing and validating and just being kind to yourself. But sometimes having a professional to help you get unstuck when you're feeling stuck can be helpful. So likewise, having a trusted professional to help you evaluate your relationship and your beliefs about control, about fairness, about equity, about some of these areas that we know might be connected to survivor guilt can also feel helpful. So we know that there can be these senses of powerlessness and helplessness and death anxiety that come up. And for some, having a supportive space to kind of explore those, talk about them, process them, is a way that they can start to sit with them in a little bit more of a comfortable way. And finally, taking some time to understand what's meaningful to you, or what is purpose, where you find purpose in your life can also be helpful. I mentioned before that there have been some studies that have looked at this and have shown that finding meaning, and again, like not someone else's meaning, your meaning, what is meaningful to you, what fills you up. These things can help you feel, have a higher quality of life and help you feel a little bit better. I think overall, with all of the coping, I think it's really important to recognize that you're not alone in these feelings of survivor guilt, and finding compassion and support for yourself, giving compassion and support to yourself can be a really important first step. So I just want to thank you so much again for having me give this talk. I hope that you found it helpful. I want to end with this image that I saw in the New York Times on artwork that was inspired by cancer patients and survivors, called Our Tangled Stories, portraying the living and the dead intertwined. It was inspired by the experience of Virginia. Thank you so much.